when it comes to putting in an IV. Is this a clean or a sterile procedure?
Clean.
It's a clean procedure. Good. Each person decides on their own with practice what they want to do, what they want their setup to be. Now, first, what you should have is your IV start kit, and it tells on there what's all in it. So in case you're like, I wonder what's in this, it'll tell you. You should have a flush, okay, normal saline. You should have an extension, which we didn't have enough, but I'm going to show you. Did you give extensions?
Yeah.
Okay, cool. So we have extensions, and you should have your IV cap on. Okay. So first thing I do, okay, of course I wash my hands, identify my patient. Okay. I open up, I get everything ready. You're going to get everything ready up until tying on that tourniquet and doing your stick. Everything. You're going to get your tape ready. You're going to get everything done. So I've got my tape, got a tourniquet, I've got a Provident iodine wipe, I've got an alcohol wipe, I've got gauze, and I have got a Tegaderm. Okay. I have my extension and I have my IV cap on. Now this is covered, there's a cap on it, so I can go ahead and take it out. And these do come in different sizes, okay? This is a 22 gauge 1 inch, okay? My favorite to put in was always a 20 gauge, except when someone would come into the ER with cardiac issues, and I would put it in 18 to a 16 gauge. I would put in what's called a large bore IV, because they need to get blood products or whatever. Okay. Now, if it was somebody coming in that just needed like IV fluids because of nausea and vomiting, I put a 22 in them because they're probably dehydrated anyway. Okay, so this is all my stuff. This is my arm, my vein. May I borrow your arm, please? So when you go to put in an IV, when you go in to put in an IV, you're going to make sure the hand is towards you. Okay, because you want to go, which way do veins flow?
Back towards the heart.
Back towards the heart. So you want to go with the blood flow of the heart. You don't want to go against. What goes this way?
Arteries.
Arteries. Good. Okay, so also when you're going to put in an IV, you always want to start with the hand and work your way up. Okay. In the ER, they'll say something different. I worked in the ER. I know that first place I would go is here. That's just first place I would go every time, because it's easy access, it's quick, the veins are bigger. Then if I couldn't get that, then I'd go to the hand. But on the floors and everything, you start with the hand, work your way up. Okay. Also, what I didn't tell the other group, you've got nice veins. Look at those. They're pretty. I remembered what I was gonna tell the other group, and it was profound, and I totally forgot. But we'll talk about it in a minute. Remind me about my profound statement.
See it now so you don't forget it.
Well, I want to confuse the situation. Okay.
You're being recorded.
I know. My profound statement is, when you go, okay, because y'all are going to work on it with tourniquets also, when you go to look for somebody's vein, I beg of you, because when you're first learning, okay, don't look. I don't want you to look. Okay, when I go to find a vein, here, she's like, when I go to find a vein, I do not look. I don't look at the site. You will see me, I will be palpating, and my head will be up here. I don't look at all. I want you guys to be like that. I don't want you to look with your eyes. Look with your hands. Okay? Because you'll have people that will say, they'll look and go, oh, I don't see a vein. You're not going to see a vein on me. Mine are deep. You're not going to see it. Okay? So, I want you to look with your hands. And I purposely do not look so I can keep that skill. That's how I want you to be. Okay, now hands, that's another statement. I mean, you can see them. Your bodybuilders, you can see them, like from a mile off. But make sure, okay, and just because they have bodybuilder veins doesn't mean you can stick them. They may be full of valves. Okay, you want to try your best not to stick through a valve. Okay.
I'll say real quick, do y'all know why Professor Harris did
Because if you blow a vein, you have to go above it.
Very nice. Did y'all hear that? If you blow a vein, you have to go above it. You can't go below it.
So if you start at the AC and you blow it, everything AC down, it's ruined.
It's done. I might as well go to the other arm. All right, so got my arm. This is my hand. Okay, I have put on a tourniquet. Okay, put it on. I found my vein that I want. I still have to set up my stuff. So I take the tourniquet off. It's still underneath the arm. Okay, but I've done what's called pop it. I popped it because it sounds like a popping noise when you take the tourniquet off. Okay, so what I'm gonna do is, first I'm gonna take my tape. You come up with your own ways of taping with time. Okay. You come up with your own ways. You come up with your own techniques. Okay. Just takes time. You sometimes mimic what you like your preceptor when you start working. You mimic them or whatever. You just come up with your own. All right. Now this is my extension tube. You've got two ends. Notice one of them has a cap on it because it's sterile underneath. This sterile end is going to go on the end of the IV Cathlon that's going into the body. That needs to be sterile, doesn't it?
Mm-hmm.
Okay. This end, okay, is what my flush is going to go on. You want to flush this with your saline before you attach it, because if you don't, you're just injecting a line of air into that vein. Okay, so you're going to put that on. I always hold it over what I got it out of and flush it. Okay, sometimes it'll go ahead and come out the end, but I'm open and make sure your clamp's not on. Okay, so this is good to go. I'm gonna stick that in there, safekeeping. All right, more trash. All right, so I found my vein. Well, I'm gonna put my tourniquet back on, and this is how I do it. I tell them to make a fist. And I go where I think I felt it before, okay, and I find my vein. Now, what I do next is my hand's down here, client's up there. Which way does the blood go in the vein? Up towards the heart. I have got a tourniquet up here, right?
Mm-hmm.
I'm going to take my alcohol and I'm going to firmly run along that vein. Okay, I'm pushing this blood up toward that tourniquet so it kind of backs up and plumps up that vein. Okay, I'm not doing this. I'm just going one direction. Okay, that works for some people, seems to work well for me. Do I flick the vein? No, you do not flick a vein. Okay, so I have found my vein. Okay. So now what I'm going to do, may I borrow your hand? All right. So now what I'm going to do is I am going to go to my site. I'm going to anchor the vein. Okay? Because people will say, oh, my veins roll. They all do. Everybody's veins roll. Doesn't matter. But you just say, okay, thank you for telling me. Instead of going, they all do. So what you're going to do is there's different ways to do it. You'll have some people that'll anchor from the top. That'll puts you at huge risk of a needle stick. You have some people that'll anchor from underneath, but to me that flattens out the vein. I don't like that technique. I am a pull down from up here with my thumb and brace it, anchor person. Okay, like I said, you'll learn your own techniques. Okay, thank you. So I've got my hand. Okay, I'm pulling down with my thumb and I'm bracing it. Okay. Also, you want to make sure you pull the skin tight, because if you don't, it really hurts. The tighter the skin when you put an IV in, the less the pain. Okay. I've had a 22 put in me that they didn't do it, and it hurts so bad because they didn't pull that skin tight. Okay. So you pull that skin. All right. So then what you're going to do, we're going to imagine I have on gloves. see the white button on this? This is your safety mechanism. When you go to put this in, okay, I hold this with my first finger and my thumb, so I will not get that finger toward the button. Because if you do, it'll retract that needle and you're like, oh. Okay, because you got to start over. Also, when you go to put it in an IV, make sure you take 2 of everything with you. Okay, because the first time you don't, you'll need it. So make sure you take 2 of everything. A lot of times they'll have a pre-made kit or like a carry thing that you can take that has a bunch of stuff in it. All right, so I'm right-handed. The way I do it is I make sure the arm is on this side of me and at an angle. That's just the way I do it. Now when you're going to put it in, notice I still have my finger away from the button. You want it to go along the vein. Okay, to get it, some people like to put it in from underneath the vein. Some people like to go top. Some people like to go to the side. I like going straight into the top. Okay. So you're going to put it in. Okay, I'm cleaned everything. So I'm pulling back. I'm going along. Oh, and also bevel up. Bevel is the hole, and it's looking at you. Okay, it looks at you. If you look at the end and you don't have a hole looking at you, the bevel's down. So you gotta make sure your bevel's up. So I'm gonna go along. Okay. And then because that bevel is gonna guide it down, which is nice. So I am now in that vein. I'm gonna look along this blue here for a flash. See if I have one. Okay, I have a flash. So then I've still got a hold of this. Notice I see me holding, I'm like using my fingers as a kickstand. It's stabilizing me, okay, on my little fingers over here. So then what I'm gonna do is I'm gonna take my left hand. I am not gonna move this hand. This hand is holding this. And I'm gonna take this finger and I'm going to advance that blue off of that IV cap, off that needle. Okay. Then what I'm going to do is I'm going to take this hand and I'm going to occlude the vein. Because if I don't, I'm going to get like a murder vein coming out the end. So then I'm going to occlude it. I'm going to, that happen? No. So sometimes what I've done is I've occluded with another finger. I'm going to pull back and then I'm going to engage my safety. Now, you will have people that will say you have to, while it's in there, engage the safety and it'll pull itself out of the vein. Please don't do that. You'll blow that vein and it'll hurt. It'll hurt your patient. You want to cause them as least amount of pain as possible. Okay, now what I just did is not according to policy on the safety regulations. They want you to do it that way. Every time I've done it that way, I've blown a vein. I choose not to. What I do is I take it out, I hold it straight up, like the Statue of Liberty, and I hit the button. So that way it's not pointing toward anybody, right? So then, what I have is, I'm occluding. Nurses should be given 5 arms when they graduate from nursing school. Alright, taking my cap off. Okay, and this takes practice. Okay, slipping that in there, twisting. Okay, I still have my tourniquet on, so I gotta come up here and pop it off, snap it, whatever. I've got all this together. So I'm holding this and I'm flushing. Then what I'll do sometimes is I will pull back on that plunger to see if I get blood. Oh look, I have blood, yeah, I got a good sight. And I'm gonna push it back in. Now, if it flushes really well, but it won't pull blood, that's okay. IVs are not meant for sites to draw blood from. That's not their point. They are meant to put fluids and stuff in the body, not take out. Okay, so as long as it flushes and it doesn't swell up or anything and there's no pain or anything like that and your patient can taste it, then you're good, because that means it's in their blood. Okay, so we're all good here. I'm gonna set this down. Next thing I'm gonna do is I'm gonna get my tegader lay it, see where it threaded in? Oops, put that back in. See where it's the threaded areas where I twisted it on? I put my Tegaderm over that because I want to put my insertion site in the middle. So I know it is covered all the way around with adhesive that'll protect it. Okay, so I've got that. Now, I take my skinny tape, sticky side up, I slip it underneath, like that, and I do a little fold over here. So this is just how I do it. So that part's still sticky. Take my other piece, and it's like an anchor. It's like a stat lock. So put that. Then I take that, okay, and I put that up there. Then I take more tape. Okay, get that ready. I can go ahead and undo that. Right there. Take more tape, and I put that there. And if I'm feeling froggy, I take more tape, and I put it there. Okay. The big thick rolls of this stuff you will have on you at all times. I love this stuff. Okay, so I'm good to go. Now, if you're going to put on the clamp, because these are positive pressured, these little things at the end, but if you're going to put on the clamp, make sure every time you engage your clamp you move it, because if you keep on putting it on and off in the same spot, you're going to permanently kink that tubing, and then the person, you can't just replace that part. You got to take out the whole thing before it's due. Okay, so make sure you move that around if you want to use it. I don't engage them because these are positive pressure. Is it okay to have a little bit of blood back up into that line? Yeah, that's all right. Okay, and also there's also policy in place at the facilities that will tell you how often you have to flush them if they're not being used. Everybody in the hospital that is admitted has an IV. Everybody. Okay, unless they're like on a rehab floor or something like that. But everybody has an IV. Also, if you go to put in an IV, okay, or you have to change one because it's been however many days, put in the new one before you take out the old one. Because if something happens while you're putting in the new one, you still have that old one to go to. Put it in the new one before you take out the old one. Okay. Also, everybody, there's a facility policies usually about your stick limit. I have my own personal stick limit. Mine is 2. I will stick someone twice, and then I won't stick them again. Because if I can't get it on the second time, I'm not going to. All right, my stick limit is 2. Now, I've had patients go, oh no, it's okay. You can go ahead and try again. It's okay. It's okay. It's okay. I'll do it a 3rd if they are insistent. But I'm not gonna, not gonna do it.
You go up the ladder. So if you've got a patient that's a difficult stick, don't go grab a buddy of yours that just graduated school with you. Like, go to your charge nurse or go to your, like, up the...
Yeah, go to your preceptor and then go to your charge nurse. And then at that point in time, then they'll probably go get either the PIC team, the IV team, somebody, if they're a real difficult stick. Somebody's gonna get them.